Welcome. This training will cover Chapter 17, Emergency Shelters, Participant Eligibility and Reimbursement, and is presented by the Oregon Department of Education Child Nutrition Programs, also known as ODE-CNP. In this video, we will go over eligible participants, infant feeding requirements, and reimbursable meals. By the end of this training, you should understand which participants a sponsor is eligible to claim meals for, understand what is needed for infant meals to be reimbursable, understand the reimbursement rate for emergency shelters, and what meal types are eligible for reimbursement in emergency shelters. In the CACFP, an eligible participant is defined as a participant that meets the requirements for a sponsor to be able to claim meals served to them for reimbursement. In the case for emergency shelters, eligible participants must be 18 years old or younger. For persons with disabilities, they are eligible for CACFP meals regardless of their age. In both cases, the participant must either be a shelter resident or receiving shelter benefits for a sponsor to be eligible to claim meals for them. As stated in the previous slide, emergency shelters can serve any child 18 years old or younger, including infants. Shelters must offer meals to infants in care if the shelter provides services for infants. Infants are defined as children from birth to 11 months old. If the shelter provides meals to older children in care, it must meet the requirement to serve infants. Emergency shelters must offer an infant formula to parents and/or guardians that meets CACFP requirements, though they may decline the shelter-provided formula. If the parent-provided formula is a credible CACFP formula, the shelter may claim the meal for reimbursement. This is a summary of what is needed for infant meals. For more information on infant feeding, please see Chapter 11, Infant Meal Pattern. Unlike older children, there is an exception for infant meals served in private family quarters. Meals served to infants outside of the congregate setting may be claimed for reimbursement if the shelter meets the following two criteria. First, the shelter must provide all the required components to the parent or guardian, and second, it must maintain records documenting the infant meals met the meal pattern. Let's do a quick knowledge check on what we have covered so far. True or false? The participant must reside at the shelter to receive CACFP benefits. The answer is false. The participant must either reside at the shelter or receive shelter services, such as day programming, to be eligible for CACFP benefits. If you did not get this question right, take a quick moment to go back and review the last couple slides. Otherwise, let's move on to reimbursable meals. Emergency shelters may claim up to 3 meal types each day: breakfast, lunch, and dinner, or any 2 meal types and 1 snack served to eligible participants for reimbursement. Participants must consume these meals in a congregate setting, meaning in a space with other participants, such as in a dining room or cafeteria. All meals are reimbursed at the free rate, as receiving shelter benefits is what qualifies the participant. For meals to be eligible for reimbursement, they must meet CACFP meal pattern requirements. More information on CACFP meal pattern requirements is available in Chapter 9, Meal Pattern Requirements. Shelters often receive food donations from food banks, restaurants, and/or individuals. There are a few things to keep in mind if your organization intends to use donated foods as part of a credible CACFP meal. Donated food may be used to prepare CACFP meals. All donated prepared combination foods must meet CACFP meal pattern requirements if the meals will be claimed for reimbursement under the CACFP. This is especially important for food that comes from a restaurant or individual. This means that combination foods must contain credible amounts of required food components. These foods must also have supporting documentation, such as recipes with crediting information or CN labels demonstrating how meals meet crediting requirements. In the event the donated meal is missing items or does not meet meal pattern requirements, shelters may need to supplement additional food items to ensure the meal meets meal pattern requirements. Let's review a couple examples of using donated foods. In example 1, the shelter receives grapes and squash from the food bank. To use these as part of a CACFP credible meal, the shelter must provide a meat alternate, grain, and milk along with these items in their minimum portion sizes. For the next example, a local restaurant donates a tray of chicken and cheese enchiladas, refried beans, and rice. This might be a complete meal at the restaurant, but the shelter needs to provide at least a fruit and milk for this meal to potentially be credible in the CACFP. Donated combination foods can be tricky to use as part of a CACFP reimbursable meal. Here are some tips that shelters may use to make use of these meals easier. First, the shelter may provide recipes that already have crediting information to donors. As long as the donor follows the recipe, the shelter knows the meal will meet the meal pattern requirements. However, if the donor makes a substitution with the recipe, make sure that they indicate what the substitution is and how much was used so the crediting information can be redetermined. Substitutions have the potential to impact how the recipe credits, especially if it is the meat alternate or grain component. If the donor provides a scratch-made meal, require that a recipe with ingredients and amounts is included. Shelter staff can use the recipe to complete a recipe analysis or RAW in the online food buying guide. Once a RAW is created, the shelter staff then know what else is needed to make a complete creditable meal. Alternatively, the shelter may decide to use the meal but not claim it for reimbursement. In that case, there should be a plan in the shelter's meal count process to ensure that donated meals without crediting information are not counted nor claimed for reimbursement. It is time for another knowledge check. From the second donated food example, if the shelter would like to use the chicken and cheese enchiladas from the restaurant as part of a CACFP reimbursable meal, what does the shelter need? Is it A, the recipe the restaurant used, B, the recipe the restaurant used with crediting information, or C, nothing? I'll give you a few moments here. The answer is B, the recipe the restaurant used with crediting information. Donated combination foods are required to have supporting documentation to demonstrate they are credible in the CACFP. If the restaurant only provides the recipe, shelter staff will need to use the recipe analysis workbook in the online USDA Food Buying Guide to determine how the recipe credits in the CACFP and maintain this information with the recipe. If you did not get this right, you are highly encouraged to go back and review slides 10 and 13. In this training, we covered eligible participants, infant feeding requirements, and reimbursable meals. ODE supports equity and excellence for every learner. This institution is an equal opportunity provider. Thank you for taking this training.